Hi everyone, welcome once again to Health in the Spotlight. My name is Rina and I'm your usual host, and we're still on the topic living in the time of COVID-19. Until recently, most people never heard of coronavirus, but it's been in existence for decades. Despite the fact that you can't see it with the naked eye, it doesn't nullify its existence. It's as real as it gets. Today's episode is an interview with a midwife who had COVID-19 and survived. She went through so much pain and suffering. Please don't go anywhere. I'll be right back to share with you her sensational story. Health in the Spotlight is proudly sponsored by Rina's Couture, designing clothing that suit your taste, giving you a chance to be you. H.I.T.S Ultra Sanitary Pad. It's organic, super absorbent, and safe for every lady to use. A very big thank you to Star Bites, the airport branch. Guys, it's a lovely place. Come meet, eat, and drink. Welcome back, everyone. I feel so blessed to have with me today Miss Dolphyne Afriyie. She's a midwife who had COVID-19 and survived. She's here to share with you her story and let you know how real coronavirus is. Welcome to Health in the Spotlight, Miss Dolphyne.
Thank you, and thanks for having me.
Anytime. So please, can you tell us a little bit about what you do?
Well, I'm a midwife. I'm currently stationed at the labor ward. I deliver babies. I give antenatal and postnatal care.
Nice.
Yeah,
Is it fun delivering babies?
of course. It's very interesting to be able to bring out another life to this earth.
Onto this earth.
Yeah,
So currently you are the labor ward.
yeah.
All right, nice. So now I know you told me that you had COVID-19.
Yeah.
Can you please tell us how it all started?
Okay, the symptoms of COVID are just like other viruses, the flu and the cold. So when it started, I thought I had malaria because I was feeling more of feverishness, headache. Um, I didn't really have pyrexia or any cough. So I was on night duty and then I started feeling those symptoms. And when I closed, I went to see my IC, my in charge, and I told her that I feel like I have malaria. And she asked me to go and test for malaria, the normal RDT. So I went to get tested for malaria and it came out negative.
Okay.
So I came back to work, and on my second day at work, it was terrible. It was getting worse.
What do you mean by it was getting worse?
I was having runny nose, severe headache. It was more like sinusitis. I
right.
couldn't bend my head. Yeah. And then I told her that I couldn't come to work again, so I'd go and see a doctor. So before I closed, I asked our security man to get me the neem leaves. Because,
Okay.
Corona was in season. I was also suspecting Corona because I wouldn't want to rule it out. So when he got me the neem leaves, I went home.
But
and
wait,
then,
so why would you go for neem? Is neem the neem leaf? Is this something that you usually take on regular
no, I had
basis?
heard people doing that because we were in the era of COVID. Everybody was doing the neem, eating a lot of fruits and vegetables. So I didn't want to take chances.
Oh, okay.
So I also
all right.
decided to do the steaming with the neem leaves. So when I got it, I went home and then I put it on fire. I was so weak to the extent that I even forgot I had something on fire. So I slept off.
Wow.
Yeah. So I woke up to visit the washroom and I realized the whole room was smoky, but I couldn't smell anything. That was when I realized I had put something on fire. I quickly went to check and
bent.
it was bent and I couldn't smell anything. And one of the symptoms of COVID is loss of smell. So immediately I went to pick my body splash and then I tried smelling it and I couldn't smell anything. That was when I got alarmed and I was like, could it be corona? So I went on Google and I started Googling some of the symptoms. I was really scared.
Yeah.
So I went to the hospital and then I was given a form to go and get tested at 37 Military Hospital. So that day I couldn't go to work, but we were only two on duty, and the other person was new, so I had to go and assist her. Around 12 midnight, I couldn't stay,
Oh,
so
you're on night duty?
yes,
Okay.
so I picked an Uber and then I came home. So I was still waiting for my results to come out. Meanwhile, I continued with the steaming, with my antibiotics.
And all that.
Yeah.
Okay, wait a minute. You did the testing, and your result was not out. You
No.
suspected COVID, all
Yeah,
right?
because I couldn't taste anything, I couldn't smell anything. I had severe headache, and then I was feeling cold most of the time, especially in the morning and then afternoon.
Oh, okay.
Yeah, so I was always in a coat and then with my fans off. Yeah.
But when you suspected COVID and you did the test, why? Because if let's say your result is not out yet, but you've gone to do the test, so why would you not like stay away and probably protect yourself and protect your friends and colleagues? But
That
then you
was why
went.
I didn't go to work again.
You didn't go to work.
No.
Oh, okay. I
I
thought you
stopped doing
said
the
you
night
went
shift.
to work.
I didn't go again. So I came to isolate myself at home. Initially, my in charge wanted to take me to Adabraka to do the test, but I was scared of being isolated there at their center because you know that place, you wouldn't get a chance to do the steaming yourself.
Okay.
So I didn't want to go. Yeah, so I told her that I would go to 37 and do it all by myself. So,
All right.
so while I was waiting for the results, I was still taking my medications, sleeping.
Wait. Were you? What medications did they give you? Because
I was prescribed IV, tabcefurosime, vitamin C, and amoxiclav, and then azithromycin.
azithromycin.
Yeah, that
So
was what I was
even though your
taking.
results were not out, they gave you medications for you
Yes.
to start taking.
Yes.
All right. Okay. So how long did it take for your results to come out?
About 3 weeks.
3
Because I
weeks.
kept following up. You know, I did it at 37 military hospital, and during the same period, I heard there were some military personnel going out of the country, so they were also testing them. So the guy told me there was a backlog on our results,
Ooh.
and the one who tested me,
Yeah.
the one who took my sample. So it was like they had held on our samples, and they were doing that of the military personnel.
So that was what made it keep long.
Yes.
Oh, okay.
So I have a doctor friend who also tested positive, and he got like when his sample was taken, he got his results in less than 4 days. So he called me and he was like, it's ready. I should just call the guy to go to Nobochi, enter my name in their system, and then he will get it. Lo and behold, he went and then it was out. By then I had already recovered because it was over 4 weeks.
Ooh.
Yes.
So you did basically the medications that they give you, and they gave you, and then the steaming. That's what you were
Yes.
doing vigorously.
When I wake up in the morning,
Yeah.
I do the steaming. I drink some. No, I boil the neem leaves alone and I cover myself with a blanket. After that, I boil one separately with the back of the pineapple, and then lemon, and then ginger, and then
Eish.
garlic, and I drink it. So around 6, I take my medications.
So you do that first before you take your
Yes,
medication?
I didn't want to take them all together.
Together. All right.
Yeah.
Okay. And would you say that it really helped and facilitated your recovery?
Yes, because whenever I did the steaming, I felt a little bit relieved. My head was usually heavy, but whenever I did the neem, I felt relief. It felt a bit lighter. Yeah.
Were there any sort of side effects to any of the medications that you were taking?
I was eating too much. I realized I could even eat 2 balls of banku within an hour.
Hey.
I would be craving for food. Yes, I was eating too much, and you know I was alone. And a few friends I had told I had tested for COVID and awaiting results, they were scared to come closer. And because I had lost taste for smell, and then like loss of taste,
Yeah.
I couldn't cook. You know, so I always wanted someone to get me food. And there was a time I called a friend to get me food, and he was like, if it were me, would I come? So I was like, wow. And I was hungry. I was shivering. I was so hungry that I called the guy and I told him that, are these some of the side effects of the medication? Because I realized I was eating too much. I would eat right now and then I want to eat again. Yeah. So I think those were the side effects I had.
I think you said that you told your friends that you tested positive. And what
They,
about
they,
your
they
family?
stopped coming to me. They didn't want to visit me at home
But
anymore.
you, if you will, you go.
Oh, maybe I wouldn't enter, but to get you food, I'll try and then leave it at your doorstep.
So no, nobody got you food.
Oh, I sent money to one of my mates
Oh,
to
okay.
prepare some stews for me, and then my next door neighbor brought me banku in some flags,
Oh,
so it
okay.
helped me. And then that friend I called, I was there later, and he called me to go in front of my door, and then he had left me watching. So thank you for the watching.
So would you say that you never had any stigma from your friends? You told your family as well.
Yeah, I told my
You
parents
told
and
no
then my
one
siblings.
stigmatized you. No, everyone.
You know, I stay alone. They are not here with me, so I didn't. But
Oh,
I
okay.
remember my H.I.T.S came to visit me. I had even recovered, and I told her to enter. She said no, she's waiting for me outside. So she stood outside for me to get to her. She didn't enter because she said she won't take any chances.
Even though you have recovered, how
Yeah.
long did it take for you to recover?
About 3 weeks.
3 weeks. Oh, okay. And the steaming was very
It was
helpful.
it was effective. I really felt relieved whenever I did that.
You did the
Yeah.
steaming.
Yeah.
When did you officially resume work? After recovery,
Um,
when did you
I
officially
think I
resume
got
work?
tested on the 17th of June. I went back to work in the first week of August. Yeah, because I was home throughout. I never went out of the door. And then when I felt like I was better, I called my workplace that I was bored. I wanted to come back to work. And they were like, no, you still talk from your head, so don't come.
What do you mean by
So
you still talk from your head?
they say when I talk, either I speak from my nose or from my head. I didn't really understand.
Ah.
So I called my mom and I asked her that, do I speak from my nose? And she was like, a little bit. And I said, oh, okay, then let me just stay home. Since they don't want me to come, I'll just be chillaxing.
You just be chillaxing.
Yeah.
So when you resumed, tell us how the reception was at work.
Well, when I resumed, I went to see my in charge, and she took me to Adabraka Polyclinic to take another sample for a testing. And then from there, we went to see a psychologist at Accra Mental.
Why did you need to see a psychologist?
I'm sure maybe he thought we would be stigmatized against, so he wanted to talk to us briefly before we resume work, or how to be able to relate with our colleagues at work or something.
Oh, okay. Do you still have the psychologist checking up on
Yeah.
you?
Yes, he does. Even today.
Even today,
Yes, he's been checking on me.
So what do you guys usually? What's the kind of
He's
conversation you have?
been asking me how I'm faring, how work is, if I'm on duty, is everything okay? Just those normal things. Yeah.
Oh, okay, all right, sure. Well, viewers, it's been enlightening, and I really don't want to end, but we have to take a quick break. So please keep watching. I'll be right back. Health in the Spotlight is proudly sponsored by Rina's Couture, designing clothing that suit your taste, giving you a chance to be you. Phaetex Ultra Sanitary Pad. It's organic, super absorbent, and safe for every lady to use. A very big thank you to Star Bites, the airport branch. Guys, it's a lovely place. Come meet, eat, and drink. Welcome back, everyone. I'm still here with Miss Dolphyne, and she's still got a lot to tell us. So, Miss Dolphyne, please can I call you Auntie Midwife?
Yeah.
I want us to talk a little bit about your work in this COVID-19.
Okay.
All right. So, how has COVID-19 affected the turnout at work? Because you mentioned that you take care of pregnant women, you do delivery. So, in this COVID-19, how has the turnout been at work with the pregnant women?
You know, I work in Osu. And you know, the indigents of Osu, it's like they haven't heard about COVID. To them, COVID doesn't exist.
Oh,
Yeah, they still patronize their antenatal care. They still come.
but that's serious.
Yeah. And we are having a problem with social distancing amongst them during antenatal clinic. You separate them, and before you realize, they've all gathered at a place again. So it got to a time we had to talk to them, those are the Presby churchyard, to give us a space to be able to contain some of them there, because they were always grouped together.
Yeah, but what was it? I think it has to do with the fact that they don't believe COVID-19 or coronavirus is
And it's
real.
because they are indigens there and they know each other. They always want to sit together when they come for antenatal.
So do people do the education because they need to be educated so that they can be able to protect
do it
themselves
every morning.
But they still don't believe it's...
Some even come without nose mask. You have to turn them away. I remember there was a time I was on the ward and a client came to pay the bills of the relative. Like a relative came to pay the bills of a client. And she wasn't in nose masks. And I was like, no nose masks, no entry, so go back. She actually went outside to collect the nose masks of a man.
You're kidding?
Who had just left the labor ward. So when I saw her, I started laughing. I was like, you just went for the marks of the other man. Then he was like, we are relatives. I said, hey, these people.
So seriously, apart from the nose mask thing, because I don't know why
you actually have to tell them, we have Veronica buckets in place. You have to tell them to go and wash your hands before they go to wash their hands. It's like they don't really believe the virus exists.
Do you tell them that you've kind of like had the virus and what you went through, maybe to kind of... You don't have to tell them.
No.
Why?
I just don't want to.
You just don't want to. But anyway, please, if you live in Osu, I beg you, coronavirus is very, very real. And we can't be sharing masks. You don't know what the person has, and you don't know what kind of infection or anything that the person has, and you're going to take the mask. So I beg you, please, let's protect ourselves. So when the pregnant women, when a pregnant woman has COVID-19, will it affect the child?
Well, there hasn't been any research to show that the virus can pass through the... there hasn't been any research to show that there is COVID in the amniotic fluid or in breast milk.
Oh, okay.
But I've heard mothers who are positive having babies who are also positive.
You've heard?
Yes.
Oh, okay, you've had mothers who have tested positive, and then their babies have also had, like, they've been positive to COVID-19.
Yes, but there is no research to show that the virus can be found in any amniotic fluid or in the breast milk.
Oh, okay, well, so right now, if the baby tests positive and the mother also tests positive, do you restrain? I'm thinking of how you restrain. Would they have to stop breastfeeding, or they'll still breastfeed, or what do you...
I think you should still breastfeed.
They should still breastfeed.
Yes, because you wouldn't know how the baby would survive without breast milk. And breast milk is the only essential food for the baby at that stage.
But the mother will be on medications.
Yeah.
And it will not affect the baby much.
I think the healthcare providers will talk to the relatives on how to care for the baby.
Oh, okay. All right.
They are supposed to be separated or something.
All right. Yeah. Oh, okay. All right. Sure. Anyway, thank you so much. Thank you so much. It's been a lovely session with you.
Thanks for having me.
But I want you to give us some few words on what you think that people should know out there, because you are working in a place that you said the story. So what advice will you give to people who think that corona is just one of those things that it will just come and pass, and they are just not protecting themselves, they are just living their life anyways? What advice will you give to people?
Okay, I would say that corona is very real, and it's the symptoms are like other viruses, just like the flu and the cold. And chances are, if you don't get tested, you wouldn't know if you have COVID. COVID is still there. So they should just adhere to the safety measures. Washing your hands, social distancing, sanitizing. That's all I can say. Eating well, enough rest and sleep and all that.
Thank you so much, Ms. Dolphyne. Health in the Spotlight is proudly sponsored by Rina's Couture, designing clothing that suit your taste, giving you a chance to be you. H.I.T.S Ultra Sanitary Pad. It's organic, super absorbent, and safe for every lady to use. A very big thank you to Star Bites, the airport branch. Guys, it's a lovely place. Come meet, eat, and drink. Well, viewers, all too soon we've come to the end of this episode. You've heard it all. Miss Dolphyne has said it. Please get tested. You are just walking there and you're asymptomatic. You think, oh, you are okay, and you're hugging and you're doing all those other things. Please get tested, know your status, and then protect yourself and protect your families. Thank you, and keep watching Health in the Spotlight. Love you all. Bye.